As we get older, our facial skin sags, but there are many procedures that can help combat the natural effects of aging. Joining us is Dr. Marc DuPéré from the Ageless Clinic to explain how he can help you recapture your youthful appearance. This is Daily Web TV. Today, we're discussing beauty from the neck up with board-certified plastic surgeon Dr. Marc DuPéré. Dr. DuPéré, what is the most common complaint you have from women when they come to see you?
For their face, what they complain the most would be first their neck, the sagging part of the neck, and their eyelids.
Now, when you say eyelids, what type of things are we looking for in the eyelids? When would you know you need to have something done?
Well, if we talk about the upper lids, we commonly see sagging of the eyebrow that's coming down. There's puffiness in the upper lid, which is a combination of excessive skin and some fat pads that are just herniating out from the ocular area. For the lower lids, we commonly have people complain of the puffiness, which is fat pads, and the wrinkles.
So what can you do for underneath the eyes?
There are a few options. The easy options with very low minimal downtime is to put a little bit of filler in the groove between the lid and the cheek where people lose fat as they get a bit older. And if this fails, or if the patient wants something more definitive, that would be a surgical lift or a blepharoplasty.
And that is just for the eyes, or would that involve the whole face?
Well, if we just talk about the eyes, that would be just the lower lid blepharoplasty procedure, or the upper lids where we remove the excessive skin and the fat pads. If somebody complains of, for example, sagging of other parts, such as the neck, which is also a common complaint from my patient, then the options would be more surgical. And there are different degrees of severity of a neck problem. And a small issue, a little bit of fat accumulation, would be just localized liposuction. Some people who start having the banding of their muscles in the neck, we can repair this by repairing the muscle through a little incision under the chin. And for somebody who has more sagging, more skin in excess, then it's a combination of front surgery and a lift behind the ears.
So you can do this in stages as you need it?
Yes.
A little bit of lipo, then a little lift, and then the full thing eventually.
Depending on the results that the patient is looking for and depending on her or his anatomy.
Now, we know today you can stave off surgery for a while with Botox and fillers. Let's talk about where you can use those.
Well, if we talk about Botox, Botox is a great medication that we can use to give a brow lift, for example, to somebody by treating the crow's feet, by treating the angry lines or the glabellar lines, and a little bit on the forehead. We can achieve some brow lift, which will not equal a surgical brow lift, but it will buy a bit of time for my patients.
Nice.
And for the filler is a great tool to replenish volumes in faces. And the first spot that I like to treat would be the cheeks. As we get older, the cheeks gets hollow, the fold gets deeper, and by replenishing the volume in the cheeks, it gives anybody 5 to 10 years younger look.
Great information, Dr. DuPéré. And if someone would like to learn more,
they can reach us on our website, theagelessclinic.ca or visageclinic.com.
Thanks so much. You can look 5 to 10 years younger with Dr. Marc DuPéré. Visit theagelessclinic.ca or visageclinic.com. Keeping you informed, I'm Sheila Clark, and you've been watching Daily Web TV.